Colonoscopy. A colonoscopy is a common procedure to check the health of your colon. A colonoscopy can find the cause of problems such as changes in your bowel movements, bloody stool, belly pain, and weight loss. And it can find colon cancer early when it's most treatable. The colon is commonly known as the large intestine. It's a hollow tube that runs between your small intestine and your rectum. The food you eat travels through your colon where nutrients and water are absorbed. The leftover waste becomes stool that exits your body through the anus. Your colon is shaped a bit like an upside-down letter U with a tail at the end. The part that travels up the right side of your abdomen is called the ascending colon. As it crosses the body under your liver, it is called the transverse colon, and the part that turns and goes down the left side of your abdomen is called the descending colon. The sigmoid colon bends back toward the middle of the body and down into the rectum. The lining of the colon can sometimes have problems. It may have ulcers or sores that bleed. It may have areas that are inflamed, and it may have small growths called polyps. All of these can cause symptoms such as pain or diarrhea, or be signs of cancer. Most healthcare providers recommend that people have a colonoscopy when they turn 50, and again every 5 to 10 years after that. Before the procedure. Before a colonoscopy, your healthcare provider will explain the procedure to you. He or she will give you instructions on how to prepare. Be sure to tell your healthcare provider about any medicines you're taking, prescription and over-the-counter, as well as any supplements. You'll need to empty your colon of all solid material before the procedure. This is called a bowel prep. You may be told to only have clear liquids for 1 to 3 days beforehand. You should not drink liquids with red dyes. You can have water, coffee or tea with no cream or milk, clear broth, sports drinks, gelatins, and strained fruit juices like apple juice. You will also have to drink a special solution the day or night before the colonoscopy. This solution helps clear your colon. It's a strong laxative. You'll want to be near a bathroom after taking it. Your healthcare provider may also prescribe you pills or enemas to help with the bowel prep. Tell your healthcare provider if you are unable to complete any part of the bowel prep. He or she may have to reschedule the test. If your colon is not completely clear, your healthcare provider may miss a problem. What to expect? A colonoscopy takes 30 minutes to an hour. Before the procedure, you'll be given a sedative to make you relax or sleep. You'll lie down on your side on an exam table. Your healthcare provider may monitor your vital signs. During your colonoscopy, your provider uses a special flexible tool called a colonoscope. The tip of the colonoscope is inserted into the anus. As it's moved into the rectum, air will flow into your colon to help it expand. If you're awake during the procedure, you may feel some cramping or have a feeling like you need to have a bowel movement. You may be able to watch the video screen and see the inside of your colon. If you have polyps in your colon, your provider may use special tools inside the colonoscope to remove the polyp. A sample of tissue may also be taken to test in a lab. This is called a biopsy. After the procedure. After the test, you'll need to rest until the medicine wears off. Then you'll need someone to drive you home. You might feel sleepy for a while after you get home. You may also have a lot of gas. You'll get your results within a week or 2 after the test. Your healthcare provider will talk with you about them. Things to remember. Colonoscopy can help find the cause of symptoms such as bleeding or change in bowel movements. Colonoscopy can help find colon cancer before you have symptoms. Small samples of tissue called biopsies can be taken during the test. What we have learned. No prep is needed before colonoscopy. True or false? The answer is false. You may be told to have only clear liquids for 1 to 3 days beforehand. You will also have to drink a special solution the day or night before the test. you'll be able to drive yourself home after the procedure. True or false? The answer is false. Because of the sedatives given before a colonoscopy, you'll need someone to drive you home after the test.